Hi, I'm Justin. I'm a student nurse from NSC IV College, and I've been given the honor of teaching IV class today. So, before we get into the whole IV teaching, we have a minimum requirement, a standard of professionalism every time we come in contact with a patient. So, before we do this, let's do this.
Hi. Makes me a little nervous.
You should be. Checking the provider's orders and care plan, I find no discrepancies or contraindications. I will maintain standard precautions and use BSI.
Yes, come in.
Hi!
Hi.
So let me pull this curtain here so I'll give you a little bit of privacy.
Sorry, I was falling asleep. Just a little.
Been that long? I'm Justin. I'm a student nurse from NSC IV College. I'm here to do an IV on you today. Before I begin, let me just wash my hands, okay?
Okay.
All right. Okay, what's your name?
Harlequin Quinzel.
Harlequin. That's an interesting name. I think I've heard it somewhere before. Do you go by Harlequin?
No, I go by Harley Quinn.
Oh, I have heard of you before. Can I see your ID then?
Yes.
Awesome. Okay, and what's your date of birth, Harley?
10/10/79.
Okay, and do you have any allergies or medications? Okay, all right. So today I'm here to do an IV on you. Have you ever had an IV before?
No.
Okay, so basically I need access to your veins in case I need to give medication, or I need emergency access to your vascular system, or if I need to replace fluids. Those are the 3 points that I need to make. Anyway, so I'll be sticking a needle into one of your veins, and then, just so you're aware, I pull the needle out, but I leave a little straw in there. So if I put it in like a place that bends, which I don't want to, but if I do put it in there, I have to, I have no other choice, you can still bend your extremities, okay?
Okay.
All right, and it won't like impale you the rest of the way.
Oh, thank God.
It's just a little straw there.
So needles won't come out?
No needles are, well, I'm gonna pull the needle out, but it won't like come out the other side or anything silly like that, okay? All right, do you have any questions for me?
Is it gonna hurt?
Yeah, it will, but I'll be quick, I'll be smooth, and if you need me to stop, I'll stop.
Okay.
All right, also, just so you're aware, the doctor and everyone here has your best interest in mind, but that being said, you do have the right to refuse all procedures. Okay?
Okay.
All right.
But I need this, right? I should probably get
The
this.
doctor is telling me you need it. So, are you okay with it?
Yes.
Very good. Okay, so let me prepare my equipment, and then we'll get started, okay?
Okay.
All right.
Thank you, Justin, your student nurse at Madison State College.
Did I miss anything? Okay. Okay. So, doing okay now that you have your IV?
I'm good.
Okay. Wasn't too terrible?
No, you did a really good job.
All
You're
right.
very nice.
Awesome. All right, so I'm going to go ahead and lower the bed. I'm going to raise up your rails here so you don't fall out. Here's your call light.
Thank you.
Do you have any questions for me before I leave?
No, I'm good.
All right. Your doctor should be back in here shortly. I should be back in about 30 minutes. Otherwise, if you need anything,
Ding, ding.
all right, good deal. I'm going to go ahead and dispose of my PPE and wash my hands. Bye-bye. So we're making great progress, but before we go any further, I have to discuss poor patient outcomes and IV infiltrates. So first thing I'm going to say is these are our patients and they've come to us for help. Mistakes happen, we are only human, but we need to make sure that these mistakes and these kind of mistakes don't happen very often. So a quick internet search will show you images and pictures of all kinds of complications from IVs that are infiltrated or have become necrotic or infected. Everything from phlebitis to bruises to loss of limb, necrotic tissue. These are serious. And if those pictures and these comments aren't enough to get your attention, you got to understand a lot of these pictures came from internet sites of attorneys. They're watching us and they're holding us accountable for these actions. This next picture is kind of interesting. So this is a baby and this baby's got an IV. A lot of times they'll start IVs on children and then they'll wrap them with Curlex and a board so the child can't move their hand, they can't bend their extremity. They also have a hard time pulling the IV out. I have no problem with that. I understand the logic behind it. The problem I have is how do you assess whether or not this IV becomes infiltrated? The answer is you have to do your job. You have to peel back the Curlex. You have to take off the wrapping. You have to take off the board and assess the patient's arm. You have to, because you're a patient advocate and because these things do infiltrate, especially over time. And if you do become complacent, if you don't take the proper steps, things like this happen. This can be entirely preventable. This doesn't have to happen. And what are you going to tell that child's parents about what happened and how this happened? So this hits pretty close to home for me. A friend of mine had this happen to his child here locally. This was a few years back, and they ran D5 in the IV overnight. And by the time anyone figured out what had happened, the vein had been infiltrated overnight and the tissue was necrotic. And by the time everything was said and done, the child lost quite a bit of function in that hand permanently. Another common IV site for children, for babies, is in their head. Can you imagine the kind of damage that would be caused if this IV infiltrated and became necrotic? The kind of scar tissue that would ensue? Not really that common, you think? This is Nicole. Nicole had to have an IV placed in her head prior to going in for open heart surgery. And as her daddy, I can tell you, I was terrified. One alternative to wrapping a child's whole arm are these little clear dome things. And I've been seeing them a little more often in the hospital as well. Okay, so that's done. And we're still not here yet. First, you have to prepare your equipment. Gather it, prepare it, and part of that is knowing what you're dealing with, what your equipment is and what you're looking at. So, I brought some equipment today. So let's start. We'll go through one piece at a time, right? Okay, so today we got alcohol preps. They also have fluoride preps, but we don't have that today, so we're just gonna use these. We also have, once you've cleaned your site, prior to cleaning your site, you've got these tourniquets. They're no longer made out of latex, so you don't have to worry about that. You're gonna wrap that around it to make the IV pop up, okay? Next, we'll go into IVs or needles. So this, I brought this one, is a 14 gauge IV. That is a big IV. I don't want one. And I don't think I've ever started one. I've started 16s, I've started a lot of 16s, but this thing is huge. So the way this works, a lot of them are different. They have several different kinds. Some of them don't have any safety procedures or precautions on them at all. This one here, actually the needle slides inside the hub. And that prevents you from getting accidental stick. So, with this one, some of them have a little button that you push and that slides it inside as well. Some, as you pull the needle out, a little clip comes down and actually clamps on the end, so you can't stab yourself that way. So, the way this works is once you get it in, and you push this little tab here with your finger, and that will slide the needle inside. You disconnect your hub, and this is the part that stays inside the patient's arm. And it's basically just a little straw. Let's see inside that, just like that. You'll then take your IV tubing and your lock, and you'll attach it to that. Today we have the extension tubing, but we don't have the lock. But I do have a lock from IV tubing to show you what it looks like. So this is what a lock on IV tubing looks like. Kind of an extension piece. So we're not going to pay attention to any of this here, and this little tab here is gone. So this is what it would look like normally. And you have your normal saline flush, right? And you put that on, whoops, you put that on the back here. I'm trying to hide that piece. So you put that on the back here and you just twist it in place like that. And you'd flush it, a little air out of there prior to putting it on the lock. Oops. You'd flush it prior to putting it on the lock, just like that. All right. So in this particular case, since we don't have the lock, we're just going to attach this straight to we're going to attach the flush straight to the extension. So we pull off the little piece of blue. We want to clean that with alcohol. Attach, same way, just twist it on. And then this little piece here is what will attach to your catheter. And then you just flush it. Okay? All right. So not only did I bring the 14 gauge to see the details on it, but I also brought a 24 gauge. See the difference? There's a huge difference. This one you're gonna use on babies or on people who have really bad access and very small veins. You're not gonna get a lot of fluid through that, obviously. Whereas opposed to this one here, you're gonna get a lot of fluid through. But we'll go over that later. While I've got you here, we're gonna get into this stuff little bit later, but this one, you can actually see it. That hole there, see how it's at a weird angle? That's called the bevel. You always want to start it bevel down, like that. You can start it this way, but it'll hurt. And there's no reason to damage your patient's tissue or hurt your patients. So you're gonna go in like this, 15-degree angle, and that's gonna be your cutting point, right there, okay? All right. Next, we have, we're gonna have to find a way to tie it down. A couple different options for that. We have IV tape, we have paper tape, in case you have an allergy to regular tape, or we have Tegaderm patches. These things are awesome. Some people call them toilet seats because they look a little different. The toilet seat ones look like little toilet bowls. But these, I love these. These things are awesome because not only are they softer and gentler on the patient, do they also form better over the site, but they come with this really cool little area here you can actually write your notes on, which documentation will come into that later. Initials, time, date, all that stuff. Next, we have IV tubing that will be attached to your bag of saline, your normal saline. And lastly, we have pump tubing, but we'll get into that later, okay? And in case you have a mess, we also have 2x2s to clean it up with. And we also have providine, iodine. But I don't want to use this because I have family members that are allergic. So, not even going to open it up. Okay. Oh, lastly, I tried to get a hold of, I went up through all week long, I've been trying to go up the chain of command at my facility to get an IV arm to actually start them on. And it went all the way up the chain of command in order to get it, and I got approval. I was waiting for Friday so I could get it, and the guy who was supposed to unlock the training cabinet went home and forgot. So, improvise, adapt, and overcome. This is our arm today. These are our veins, and this is the arm. We use what we can, right? Now we're ready.